There we go. And so I think a good place to start is just to provide a high-level overview of what this program will look like. For LTSS PE, applicants will self-attest to meeting both financial and functional eligibility. What that looks like is there will be a referral form or application form available online. And on that form, there will be questions that will allow someone to self-attest to meeting functional eligibility for HCBS or level of care eligibility, and also financial eligibility for long-term care Medicaid. There will also be questions on there to allow someone to attest and then verify to meeting certain crisis criteria. The goal with this program is that someone will be able to receive a small selection of services to help support them during and through a crisis period while their long-term care Medicaid application is being processed. This program is being implemented through our 1115 demonstration waiver. If you don't know what that is, 1115 waivers allow states the flexibility to pilot new programs. Colorado's 1115 has historically supported the substance use disorder program. And so Colorado is requesting permission from CMS, or the Center for Medicare and Medicaid Services, to expand our 1115 to include presumptive eligibility for LTSS. Following this timeline, our targeted implementation date may likely be January 1st of 2026. And then the last bullet point, we're still looking at being able to determine the number of individuals we'll be able to serve through this new program, but may fall somewhere around 100 to 200 individuals per year. Here's a look at what our crisis eligibility criteria as well as the included services may be. You can see here the crisis eligibility criteria we're looking at, which is a loss or incapacitation of caregiver, having experienced a recent acute medical or a mental health episode, and or being a danger to oneself or others. You can see the handful of services. That includes personal care or homemaker, respite, home delivered meals, a personal emergency response system, transition coordination, and long-term home health. These are two specific pieces of criteria. Oh, thanks, Kathleen. Will this PowerPoint be sent out to the group? Can it be? Yes, absolutely. I will send this out to the group when we are done. Thanks for asking. These are two key pieces of criteria that we really have been asking for feedback on, and we've been getting a lot of feedback on it. So I will highlight some ways that you can provide feedback at the end of this presentation. And now, as far as program updates, like I mentioned before, we're looking at implementing this new program through the expansion of our 1115. As part of that 1115 application process, we had a 30-day period where our 1115 application, all 200, 300 pages of it, were posted publicly for review, and the public was able to provide comment. That period just ended on October 10th last week. It was from September 10th to October 10th, and it will be extended for an additional 30 days for tribal consult. We did receive some feedback specifically about this new presumptive eligibility program, and some of the feedback included concerns about workload impact for counties and case management agencies. There were suggestions for crisis eligibility criteria. There were suggestions for what services to include or not to include during the PE, the presumptive eligibility period, as well as there were suggestions for possible future phases of this program. All the feedback that we received, as well as HICPUF responses, will be posted for public viewing once we submit our request to CMS, or the 1115 application to CMS, on or before January 1st of 2025. As far as program developments go, through the last several months of meeting with our across divisions within the department, as well as meeting with a lot of external groups, it's really given us the opportunity to kind of hone in and narrow down how we see the different roles and responsibilities happening for all the different entities who will be involved with this new program. And over the next 2 or 3 slides, you'll kind of see an example of what I mean by that. You'll see an example of kind of the roles and responsibilities that we're talking through. One great example of how we have received feedback that has helped shaped shaped our vision of the program is we had originally been thinking that we would have a third-party vendor or a third-party entity process financial eligibility for those during the LTSS PE period. We did hear from our county partners that that is not something they want. They want to maintain ownership and integrity of the financial eligibility processing. And so then we shifted our vision to allow the counties to maintain that part. We had also originally thought that we were going to include all services during the PE period. We have since, through much feedback, narrowed that to just a small handful of LTSS services to be included, partly for budgetary reasons, because we do have kind of a set budget to work with as part of the 1115. And also, we really support the idea of our members being able to make informed choice of the program that they end up in ultimately, and to go through the whole choosing process during the intake steps with the case management agency. As far as stakeholder engagement, we have done a ton of stakeholder engagement from the beginning of August through today. We have outreached stakeholders over 30 times. That has included lots of meetings, webinars, training sessions, as well as some entries in some newsletters, some public-facing newsletters. And like I mentioned, we've really gotten a lot of great feedback from that and want to continue to do so. Oh, and you see the bullet that says work groups on there. We're continuing to hold work groups, including those across divisions within our department, as well as some ongoing monthly work groups with specific entities outside the department as well. And then I have my website, or not my website, the presumptive eligibility website posted on here. There will be another opportunity to see that email address, or I'm sorry, the website address in a future slide, but that is where you can be kept updated with all developments about this program. I mentioned that I wanted to show you kind of one of the process flows we're working through. What you see here is a lot of different colored boxes that represent the different entities who will be involved during this program. It does kind of seem like a lot, but hopefully if I explain it, it'll become a little bit more clear. So the top row, the light orange, represents the person or entity who will be responsible for receiving the LTSS PE referral form or application, making sure it's complete, and then sending the referral to the county for financial eligibility processing, and also sending the referral to, if you can see the third row down, kind of the mauve or pink, that will be an entity who will be kind of facilitating the LTSS PE program. But back up to the orange, the enrollment coordinator is what we're calling that person or entity. Like I mentioned, they'll be responsible for receiving the referral, sending the referral on to those two entities, and then they will also be kind of tracking the applicant all the way through HCBS enrollment. And then the second level down, like I mentioned, represents the county. Their process will remain largely as it is. They'll receive the referral, open the case for long-term care financial eligibility processing, and then go through their regular timelines and processes. And then the third entity down, like I mentioned, is going to be the one who will be facilitating the program as far as authorizing and initiating the LTSS PE services, serving kind of as an assistant to help someone complete their long-term care Medicaid application, serving as a coordinator between as far as communicating with the different entities, with the individual, if that's needed, and then again, walking the individual all the way through HCBS enrollment. And then the very bottom row, the light blue, represents the case management agency, and their processes will also remain largely as they are. Once they receive the referral for level of care or processing and other intake steps, their timelines and processes will remain largely as they currently are. So let me go back. So as far as this pink entity right here, what we're currently looking at is that this will be an entity much like our transition coordination agencies, the level of care management and support that they currently offer. While transition coordination agencies may not be the only entities to fill this role, they may be one who does fill this role. And so I kind of put TCAs, transition coordination agencies, in here just kind of for reference as excuse me, as an example of the kind and level of support that we would like to see for this role. This is a lot of information, and I don't expect everyone to absorb all of this right now. But as I mentioned on a previous slide, we've really had the opportunity lately to hone in and narrow down on some of these more granular details about what the process flow will need to look like. And so this is just an example of some, excuse me, just a second while I get some water. This is just an example of some different steps and timelines needed during the LTSS PE process. This represents the TCA's meeting with the member, initiating services, getting paperwork signed, meeting with the member, or I'm sorry, not meeting, yeah, meeting with the member initially, but then also throughout the course of the presumptive eligibility period, kind of checking in with them to monitor their well-being and monitor their service satisfaction, and then coordinating between the case management agency and the individual if needed, helping to complete the long-term care Medicaid application and also provide the verifications needed. And then at the very end, once someone's eligibility is determined, they would use the risk level assessment that's currently in place to help determine how much longer they provide support to the individual. Similarly, if I can back up 2 more slides. So this orange entity at the top, the LTSS PE enrollment coordinator, we kind of hashed out a more granular idea of what that process flow would look like. Again, none of these are set in stone. These are just kind of ideas. You kind of have to hash something out in order to see what's going to work and what's not going to work. And so you can kind of see this process here. Like I mentioned before, they would be the ones to receive the initial referral form or application and kind of track the individual all the way through program enrollment. They would do not as much not really any kind of like tracking to make sure things are happening within timelines, all the way through the member being in HCBS. I mentioned that we've been getting a lot of feedback from a lot of people, and this is something that we very much want to continue to do so. We know that our stakeholders have a lot of unique perspectives and input to share, and it's really how we can best make a program that's going to be useful and successful for the people that we want to serve is by receiving some stakeholder feedback. And so here are just a few ideas. What do we need to consider when identifying these different roles and responsibilities? What potential bottlenecks or challenges do we need to focus on? And also, what level and or frequency of engagement about this program would be helpful moving forward? And this is, I don't really have very much more to share after this slide. And so if you'd like, I'd be really happy to open it up to some discussion if this group would like to provide any feedback on these things. Oh, and I didn't even see the first question from you, Allie. I apologize. Allie asked a while ago, what kind of functional questions are on this form? Do they correlate with the current 100.2 that case management agencies use for functional eligibility? That's a great question. And the answer is yes, absolutely. We've been meeting quite extensively with our care and case management team to make sure that the questions kind of walk the fine line between reflecting what's in the care and case management system, and also being accessible and able to be answered by an individual through self-declaration. So lots and lots of hours, many hours and lots of work have gone into that process to make sure that it's accurately reflecting, yet not prohibitive for someone who's going to be trying to fill this out, or the representative trying to fill this out for them. Thank you for that question. What other questions or what other feedback do you have? We have like a whole 45 minutes left, and so I would love to hear some more. Jennifer said, some single entry points are taking 6 months to respond to referrals for current HCBS referrals. Will this program be any faster on getting the functional assessment done? So thanks for that question, Jennifer. So like I mentioned before, we're not looking at asking the case management agencies or single entry points to expedite timelines. What we would really like to think about, if I can go back a couple of slides here, uh, what we're very much trying to think through is what can be done kind of on the front end to help make sure that things are happening in a timely process. And so I would love this group's feedback on that in particular. So um, we were thinking maybe that the transition coordination agency would be sending the referral to the case management agency. Maybe this would happen kind of electronically or automatically through CBMS. We're talking that part through. But to help kind of mitigate any bottlenecks or slowness, we've been trying to talk with our stakeholders about what can be done on the front end from any of these entities to help streamline the process. And so that I don't have a great answer for you other than it's something that we're really focusing on. Any thoughts about that from anyone in this group? Or I'd be curious to hear, is that other people's experience as well? Have other people been experiencing kind of a longer timeline with the case management agencies? I see one hand. Yeah, go ahead, Amy. And
Oh, and I'm invisible. I have the question regarding, they're going to try to do this for 3 months. Is this PE LTSS time period? And following up what other people are saying, just getting through the ARG process right now can take more than 3 months. So is there going to be a way to extend that time if the CMAs and counties, if it just takes them longer to process, so that the person won't go 3 months, then lose services while they're waiting?
thanks for that question. You're really honing in on some areas of focus that we've been talking about. So the 90 days, so we are looking at a 90-day period for the LTSS presumptive eligibility period. Unfortunately, we do not have flexibility with being able to extend that per federal regulations. It is something that we explored and we're kind of told, no, that's not possible. However, we're also very much aware of the current ARG processing timelines, and we are really looking at and talking about ways to help expedite that process. Well, we don't want to look at expediting the county financial eligibility processes or case management agency. We do very much understand that the ARG processing timelines need to be looked at, and there needs to be some kind of workaround to help people fit within that 90-day timeline. Katie, I see you have your hand up.
Yeah, thank you. I had the same question as Amy, and one of the things that when I'm looking at these flow charts, I'm trying to figure out, it looks like the Transition Coordination Agency will use the CCM system, and the LTSS, the PE enrollment coordinator, will need access to CBMF. So I'm trying to figure out that coordinator, that enrollment coordinator, who will they be working for? And then, because part of the reason I'm asking is like the handoff to CBMS, the handoff to the counties via CBMS. And if this enrollment coordinator has access to CBMS, is there a way to, make sure that there's a pen to put in place if you're waiting for an ARG application to go through the disability process, or if there are continued backlogs at the CMAs, which we also have been hearing a lot about, particularly during the stabilization efforts. Like, I'm curious about how that person could make sure that CBMS doesn't automatically terminate folks simply because they're waiting.
Yeah, thank you for that, Katie. Or Kate, I see a Katie and I see a Kate. Um, yes, sorry. I was going to answer your question and then it left my head because I thought I was getting your name wrong. As far as who the enrollment coordinator will be, we're still talking through that, whether that's an entity or an individual at the state. We're talking through that part, and that hasn't been decided completely yet. But it's a really good point about being able to put append in CBMS for processing ARG, and so I definitely wrote that down. So I appreciate that input. I do see a lot of things coming through the chat, which I'm really happy about. And so let me make sure I get them all. Kathleen said, yes, we have experienced long waits. I think that's referring to case management agencies. Linda's saying, if approved for presumptive eligibility, do I understand that's only 90 days? Yes, same thing. What happens if the arbor decision has not been made within 30 days? Can they do an additional 90 days PE? Like I said, we've been told that we can't extend the 90-day piece at all, but we are definitely talking a lot about different ways to help mitigate that that bottleneck as far as ARG or arbor decisions. Deanne said, I saw on the flow charts that Adult Protective Services was a referring party. Can you explain this more? I don't, let me see. Oh, as far, are you referring to this part where make a referral to APS? And so what we've been talking through, and I think, I don't know if this is what you're talking about, but you can come off mute and correct me if not. So what we are talking about is we're also looking at, is there going to be a workload impact to Adult Protective Services? And so what we are looking at is, ensuring that this PE enrollment quarter is really well versed in what criteria necessitates a referral to Adult Protective Services. And also, is there anything that can be done on the enrollment coordinator side to help kind of lessen or mitigate that workload impact with these APS referrals? Because one of the crisis criteria that we're looking at includes being a danger to oneself or others, as well as a loss or incapacitation of caregiver, those could be kind of ripe for APS referrals. And so that's just something that we're looking at. Linda, does that, no, Deanne, does that answer that question?
I was looking at that cloud that had the APS. I just wanted to make sure that there were other avenues than just APS. Anyone can fill out the referral form, correct?
Exactly. Yep. We're looking at it just being kind of available to those who need it. I mean, yeah, and available online to anyone.
So, for example, our chapter works with the ADA coordinator from our local detention center, and we often work in tandem with them. So they could also see this as an avenue if they felt someone potentially could qualify.
Yeah, I mean,
Okay,
it really is open to anyone as long as they meet the, financial, functional, and crisis eligibility criteria for sure.
okay, thank you.
Thank you. I see Allie said there are a lot of factors. There are a lot of factors. Is there an Arbor app needed? That takes longest. Yeah. Yes, the Arbor app, we definitely recognize as it could be a big bottleneck. So that does take the longest. We are aware that that sadly is the case. And so definitely talking through ways to help mitigate that wait. Deanne said, yes, we have experienced longer than 6 months, even for referrals. I think you're talking about case management agencies. This is really good feedback. In fact, I'm going to make a note about this. Everyone has access to CBMS. Absolutely. Yeah. So as far as the enrollment coordinator having access to CBMS, we do recognize that that is something that we'll have to work through and make sure is in place. HCPF is taking 6 to 9 months to make trust determinations or income trusts. They have backlog too. I'm going to make a note of that as well, Jennifer. Thank you for that feedback. That's something that we will continue to talk about and work through. Thank you for that. Allie said, let's not send referrals through CBMS. Allie, can you talk a little bit more about that, please? If you don't want to, that's fine. We can kind of take a conversation offline if you prefer, but I would like to kind of explore your comment about definitely let's not send referrals through CBMS. And said maybe consider having that PE coordinator as a case management agency position. Thank you for that feedback. Laura said, thank you for this program. It will be very helpful for Adult Protective Services to act immediately to help at-risk adults. However, is there a way to refer individuals who do not qualify for APS? I'm thinking if there's a way to help children moving from children's waivers to adult waivers encountering a barrier to get services set up. So is there a way to refer individuals who, yes, so absolutely. So APS, qualifying for adult protective services is not a requirement to enroll onto this LTSS PE program. We were just kind of more talking about how there might be a greater likelihood of folks who are experiencing the crisis eligibility criteria, maybe also necessitating a referral to, or needing a referral to adult protective services, if that makes sense. And then I'm thinking if there's a way to help children moving from children's waivers to adult waivers, encountering a barrier to get services set up. Thanks for that feedback. That is, we have been getting that kind of feedback as far as, someone's current situation isn't currently, someone's current service program isn't serving them appropriately. Can that be considered a crisis eligibility criteria? That is something that we've heard and we're continuing to talk through as well. So thank you for that. Amy said, I'm also wondering how this will work for individuals with behavioral health services who need this program. Will the Transition Coordination Agency have expertise in doing such risk assessments for those whose primary connection to medical services is through a community behavioral health centers? I'll have to make sure I'm processing this question. So, kind of the same thing that we talked about before. We're very much aware that there may need to be kind of a behavioral health entity or partner available as a resource for these transition coordination agencies to refer someone to. But let me kind of let us kind of take down and think through this question to make sure we can answer it and address it completely. Oh, and Amy, I see that you came off mute.
Yeah, so the BHA is doing a lot of rules work, and I'm just wondering because, and I provided comments a little bit, sometimes the way people would get, they wouldn't be in a nursing home, but maybe in a mental health transition housing. And right now, what I've seen in the application is that isn't necessarily considered. So just wanting to make sure there's some kind of coordination. So if someone's coming through that BHA system, they can also move it here. An issue comes up with getting records for people who have mental health challenges. They can't usually get their records directly from a provider. So that can cause backlog. So just wanted to make sure that was on your radar.
Thank you for that. Thanks, Amy. On the topic of consent management, that is something else. That's another piece we're talking through. Is there something that can be done on the front end with this enrollment coordinator to help, streamline or, I guess, just manage consent on the front end? So that's good feedback too, Amy. Thank you. Yeah, go ahead, Kristen.
I've kind of brought this up before, but wanted to make sure we're all aware of it. But so for home health, such as long-term support services, we cannot submit without an active Medicaid ID. So currently we are actively, well, as of yesterday, we are now sending our PARs to a third party and bypassing the CMAs.
Sending
So,
the long-term home health PARs to a third party?
correct, like Telegen.
Okay, got it.
We're sending them directly there, and then they are notifying us of approvals, partial approvals or denials in regards to eligibility and approvals. And then we're supposed to identify with the CMA what they were approved for. So without an active Medicaid ID, that will be a problem.
Absolutely. Okay, thank you for that. Thanks for that, Kristen.
Sure.
Um, so let's see. I'm trying to get caught up here. So Linda said, can PE be used for children to adult transition since application for SSI and Medicaid must happen at 18? Yeah, thanks for that feedback. We're, that is something that has come up before. And so that's something that we are talking through as well, Linda. Thank you. At our case management agency, we have minimal access and knowledge of CBMS. There are so many system errors in general occurring. Sending things via system means we will have to do extra back-end work to ensure nothing is lost if system errors occur. So that kind of highlights what you were saying, like maybe don't rely on CBMS for some of the functionality for this program, is what it sounds like. Thanks for that, Allie. That does highlight some things that does highlight some additional conversations we may need to have internally within HIGPUF to help mitigate that. Let's see. Katie says, what is the plan for the people who will get on PE but lose coverage at 90 days because their application hasn't been processed, not because they were found ineligible? What tools will the enrollment coordinator have to help that person? I'm assuming they can't get back on PE at that point, but a gap in services could be incredibly difficult. Absolutely. For someone in crisis, we're asking our most vulnerable members to, enroll onto this program and receive some support for 90 days so that they can enroll onto HCBS. And I totally agree. A gap in services is what we are really aiming to avoid at all, which is really why we are trying to help determine what can be done on the front end to make that not happen. We have been talking through ideas such as, immediately when someone applies and enrolls onto LTSS PE, can they be provided with a checklist right away? Like, hey, you need to, start getting these verifications together right away. Here's a transition coordination agency. Can you give them temporary ROI access to be able to work with the financial entities to get your verifications? Can we kind of get this ball rolling as soon as possible on the front end? So we're very much talking through how to avoid that gap in services. And as far as the transition coordination agency that we're looking at to fill this role, they, kind of based on the community risk level assessment that they do, they would be able to continue providing support to members as far as different connection to community resources and different kinds of support, even past the point of long-term care Medicaid eligibility determination. So, for sure, that support would not let up. But like I said, we very much are addressing, like, we got to get this taken care of within 90 days, and how, like, what are some best ways that we can do that? If the client has been approved for SSDI or SSI, can that be a factor in the PE process that approval will be sooner? That's a great question. Obviously, that process would be a lot shorter for that individual. So, it makes sense that their financial eligibility would be able to be, processed more quickly. I don't know that we would consider prioritizing that person ahead of another one to receive services, but yeah, that would be ideal. I think we were talking to one of our eligibility folks, and I think I forget what they like, the golden package or something. When someone comes on board and already has all of these things lined up, they're like, oh, great, like this can move so much faster. So yeah, absolutely. Great point, Katie. Katie says, I'm thinking about appeals and ensuring these folks are aware they can receive continuing benefits if they're appealing. And the coordinator is aware of and able to help someone appeal or do other things or use other tools to support them or then connect them to resources. Connect them to services. So yeah, continuing to receive benefits if appealing. That's a great point. And if the coordinator is aware. Yeah, so another great point about, all of the different entities are going to have to be very well versed in all things, whether it's APS referrals, appeals, grievance filing, all of those things. So thank you for that. I'm going to make a note of that. And Katie said I think the front end work is very valuable. We should be prepared for people to lose coverage at 90 days. It will happen. It's up to the department to be prepared for how to handle it when it does. Yeah, like I said, yeah, you're probably right. You know, we can do everything we can to help prevent that. And yeah, we plan of contingency is probably a smart idea. Thank you. Is the 90 days a requirement? Deanne asks. Is there any way to request an accommodation to this policy due to case management redesign not working smoothly at this point? 90 days is a federal requirement. And like I said, we were told that that wasn't a point of flexibility. Requesting an accommodation is something new that I haven't talked about yet, internally or externally. So I'll make a note of that, and that's something for us to think about. Thank you for that, Deanne. Really great questions. Thank you. Um, It seems like we've gotten a lot of good feedback about these questions on here specifically. And so I just thought I would put this screen up here again, in case anyone thinks of anything else they want to bring up. Otherwise, my last slide is just about our website that has updated information. You can kind of keep apprised of developments as they progress. We had information about the 1115 posted on there. We also have a stakeholder feedback form that allows you to submit feedback on the program as a whole, but then there are also targeted questions surrounding the eligibility criteria and also the services. And then we have an email inbox that everyone is welcome to email feedback or questions, which is right there. We are also in the process, we are so close to establishing an LTSS PE voicemail line. It hasn't happened yet, but we're very close. And then lastly, we have an LTSS presumptive eligibility feedback log, where all the feedback that we receive from the Google stakeholder feedback form and that we receive via email is logged on there. Let's see. Is there a way that 30-day extensions could be submitted to HICPUF after the 90 days? 30-day extensions. They did this when there was a transition. Oh, my thing won't let me see all the words all at the same time. Transition in the HCA program, which is, I don't remember that acronym anymore. HCA program. There was a maximum, I believe, of three requests for 30-day extensions. Another great idea. I don't know that it hasn't come up in my conversations yet, but it's something that I'd like to. Oh, that's what it is. Home care allowance. Thank you. But that is something that we can definitely talk about internally. So thank you for that idea as well. 30-day extension. All right, I will leave these up here for just a second. And I didn't have any other slides to go over. I can revisit a slide if that would be helpful. It's paid for by state federal funds. And so this will be paid for through our 1115 budget. As states have the flexibility to pilot new programs, they have the flexibility to request budgetary authority and approval to kind of pilot these programs. And so this is federal funds, unless my manager, Matt, wants to hop on and correct me. I think it might be shared. I think it might be matched funds, state and federal. I don't know the exact details about that.
Yeah, it is paid for through our 1115 waiver authority, so that's correct. And there is a match, but that's contingent upon a number of things to be yet determined.
Thank you. Deanne asked, when does this start? So we're looking at a targeted possible implementation date of January of 2026, which means through the 1115 process, we have to walk back an entire year, meaning we will submit our application to CMS by January 1st of 25. So a little over a year from now. Oh, Pat says I almost missed Pat's. Oh, I missed a couple here. Let's see. Does the LTSS PE website list the different work groups? It does not. Those have been kind of more siloed. But as one of these questions, oh, this third bullet point on this question, what kind of engagement would be helpful moving forward? We're open to all kinds of suggestions about engagement or work groups and things like that. Can you obtain a copy of the slide deck? Yes, I will be happy to send out a copy of the slide deck to everyone who registered for this Google event. What I will do is since it's kind of hard to take down an a website address on this platform, let me post the LTSS PE website on here. So you have that. And then on the website, you will see places that you can provide feedback. You'll find our email address, as well as the Google stakeholder feedback form. Hopefully that is more accessible to everyone. Anything else I can go over again? Anything you want me to revisit, a slide you want me to pull up again? Any other questions, feedback? I really am so happy for all the great questions and feedback that you all have provided. So thank you for that, and we welcome more of that either now or in the future through the ways listed on the website. I guess on that note, if there isn't any other question, if there are no other questions or other feedback, you're welcome to, I'll hang on until someone wants to reach out kind of more directly, or you're welcome to log off during the last 15 minutes or so. But I'll stick around in case anyone else has any questions or feedback they want to share. We do plan to have another future stakeholder meeting kind of generally posted on our website. There isn't another one on there yet. We are kind of waiting to see how things shake down with our 1115 comment and kind of, the direction we need to go as a result from there. But we will be putting at least one more on our website really soon. So keep an eye on that. Anything else from anyone else? I know there are a handful of folks left. I'd be happy to talk with you kind of more informally with the time we have left. Happy to answer questions. Linda, I see you're still on. Are you a Linda I used to work with at Jefferson County a long, long time ago?
No, I haven't. I've been around forever and ever, but no, I never did work in Jefferson County.
Apologies, I thought
No problem.
that's why I recognized your name.
Yeah. I know there's multiple Linda Medinas, but no.
Oh,
I mean-
lucky for you.
Yeah. Woohoo.
Yeah. Yeah. Well, thanks for joining us.
Yes. I will go now, just hanging out just in case more questions came out that were of interest.
Yeah, thank you.
Bye. Thank you for this.
You're welcome. Rebecca, Rachel, Claudia, Shannon, Amanda, does anyone want to come off mute to talk about anything? Do you have any additional questions? Hearing none, I will go ahead and end our meeting a little bit early. No one has anything else? All right. Well, thank you again so much for joining us. Thank you for your feedback. Thank you for your interest in this program. And there will be more information to come soon. Thanks so much.